Competency 8 intervene with individuals, families, groups, organizations, and communities. For this presentation, I focused on engagement with undocumented immigrants and the low-income population. With undocumented immigrants, there's not a lot of research on specific interventions, especially within the healthcare system due to the complexity of the population and their access to healthcare services. However, from the available research, possible interventions discussed suggest different ways of engagement with the immigrant and Spanish-speaking community. Three main focus points were facilitators, the provider-patient relationship, and community involvement. And to summarize it all was that the importance to these interventions was understanding systems of clients, such as their culture, financial stability, their barriers of communication, and citizenship status. With that, facilitators, which include behavioral health professionals, social workers, medical interpreters, case managers, medical professionals, any helping professional, they act as advocates and facilitators to these clients and for these agencies providing services, so that as to most effectively engage within the process and provide the accurate assessments, interventions, and promote the best positive outcomes. By doing so, they are acting and acknowledging the systems of each client, such as their culture, their background, where they are at when they're coming to receive these services, and what barriers and obstacles that may confront them in navigating the system and being able to effectively work through the problem. These facilitators are key to promoting a positive provider-patient relationship, because if the provider is understanding of where the client is at and where they're coming from, that creates trust and positive engagement, so that as the client feels confident and able to engage as well, they are able to overcome those obstacles in a way that will promote real effective change and address the needs of that client. And overall, this is done on a community level because clinics, health departments, and resources that provide educational materials and trainings and awareness helps the community navigate these kinds of differences and these gaps within the resources, so that there are positive outcomes for both the client and the agency. With low-income clients, it's also important and just as essential to understand their systems of financial stability, their psychosocial background, their community resources, insurance plans, and healthcare needs, which all include transportation, insurance, family and friends, the foundations and charities available to them. Implementing these interventions and assessments with clients through case managers and social workers can help increase a positive provider-patient relationship, as mentioned before, with ethical considerations taken into account to make ethical decisions and provide the most effective interventions for these communities. With low-income clients or patients or individuals, there are difficult challenges and obstacles that have to be overcome. However, they are able to access resources that undocumented individuals are unable to access. However, the same with facilitators and advocates working to really address what is needed. There is room for improvement and there's room for real change among these communities. And as mentioned before, every client and every patient, every individual is different from the next. Each individual comes in with a different situation, with a different background, with a different identity. And so as advocates, as social workers, it's important to take note of that and to bring awareness that can overall affect a community. By appropriately engaging with an environment, wherever that may be, with whoever it is made up of, there are increasing chances of promoting healthy lifestyles and effective change.